Okay, this is a sagittal T2-weighted MRI of the cervical spine. We're going to discuss a couple of interesting findings. As you can visibly see in the posterior aspect in the nape of the neck, there is a subcutaneous T2 hyperintense lesion. It is having some T2 hypointense dark septae within it, but overall it appears to be just confined to the subcutaneous plane. Now if I switch over to T1 weighted image, you can see the same thing. It appears fairly homogeneously bright, the contents, while the septae within appear hypointense. Now I'll go to a fat suppress sequence. So a stir sequence over here demonstrates that the lesion is completely suppressed. So this is a fat containing lesion on the posterior nape of the neck. Let's have an axial section, have a look at it in the axial T2 weighted image. Exactly the same story, much better delineated, that there is impingement on the surface of the posterior neck muscles, but there is no infiltration into the deeper planes. Okay, so this is a subcutaneous lipoma in the nape of the neck. Now, you would have noticed in the sagittal stir image when I put it that there is something striking that is visible over here, which is a T2 hyperintense lesion that appears to be exiting the neural foramina along with the containing the nerve root. Okay, so let's see what exactly this is. So let's look at the T2 again. So here we have it. It's dilated T2 hyperintense. Let's look at it in T1. What's happening? T1, it is completely dark. So it's fluid signal intensity, basically following the CSF signal, a prominent dilated nerve root with a prominent CSF space around it. So this is typically described as dural ectasia or a lateral meningocele. Okay, so these sort of things should always, if you look at the sagittal T2 also, you will notice that there is an abnormal prominence of the posterior subarachnoid space. If you see in the posterior to the thecal sac, you can see there is a prominence, like it seems as though there is excess of CSF in the neck. All right, so this is typically seen in syndromic associations where there is meningoceles, dural ectasias, there is prominent CSF spaces in multiple levels, typically seen in neurofibromatosis type 1, Ehlers-Danlos, Marfan syndrome, and it's all syndromic associations. All right.